Now, I'm going to turn to our evening's topic and speaker. With fears in the US over the spread of Ebola, and more recently, Zika virus, it's clear that the health of people worldwide is more intertwined than ever. Diseases do not stop at national borders. And we know that to eliminate these global diseases, we must understand the economic, cultural, social, and environmental factors. Jason Beaubien is National Public Radio's Global Health Correspondent. In 2015, he and his team of reporters won the Peabody Award for their coverage of the West Africa Ebola outbreak. His topic tonight is prescription for global health. Would you please join me in welcoming Mr. Beaubien?
Thank you. Thank you so much for coming, and I really appreciate the invitation. It's great to be here. I'm going to focus tonight on what I see as this unique moment for Latin America. And it's from a perspective of dealing with public health. And I think it's an issue that many other places in the developing world eventually are going to get to. There's been incredible progress in Latin America in terms of moving people out of poverty. Many countries have moved up to middle income status. However, Latin America is in this position where it is still dealing with many of the old diseases that traditionally are associated with poor countries: infectious diseases, problems with water sanitation, problems with mosquito-borne disease. And then at the same time, as Latin America has really moved forward, they now are also getting hit at exactly the same time with a lot of the diseases that are considered diseases of the rich world: heart disease, diabetes, lifestyle diseases, as they're often called. So I kind of feel like Latin America is in this really amazing moment where they're being forced to deal with all of this at the same time. But also, it's an interesting example because as Africa develops, as countries in Southeast Asia move forward, they also probably are going to end up in this same position. So studying what's happening in Latin America right now ultimately could be incredibly beneficial for the billions of other people in the world who hopefully will also be making this move forward economically. I'm going to talk a bit about that, then hopefully open it up for questions. I'd like to get to your questions. I'd like to talk about a little bit about what we're doing at NPR to try to cover global health and try to explain some of these issues. But really, I do want to get to the things that are most important to all of you. So I'll talk for probably about 20 minutes or so, maybe a little bit more than that. And then, open it up, and there's some mics down here, and try to dive into what you guys really want to hear about the work that I do, our efforts to cover global health, and some of what I'm covering here tonight. Which brings me to the Aedes aegypti mosquito, which is the culprit in the most recent Zika outbreak in Latin America. It also spreads dengue, it spreads yellow fever. We currently are dealing with a yellow fever outbreak in Brazil, which is fairly unusual. I mean, the yellow fever has been fairly well contained. There's a very good vaccine for yellow fever. Partly why this outbreak in Brazil of yellow fever, which again is spread by this same mosquito, is so concerning is that last year there was a major outbreak of yellow fever in Angola. And there was great concern that vaccination rates throughout much of Central Africa for yellow fever were incredibly low. And yellow fever can be deadly. And people in the Angola outbreak were dying from it, not at astronomical level, but it was killing people there. And so there was this massive effort to get people vaccinated in both in Angola and in the Democratic Republic of Congo. And in the process of doing that, basically the global supplies of yellow fever vaccine were drained in order to fight this yellow fever outbreak in Angola. And so now that we have this outbreak in Brazil, which is just getting going, there's great concern that there may not be enough vaccine to fight the outbreak in Brazil. And it turns out, and who knew this, that producing the yellow fever vaccine is actually quite time consuming. And so there's concern that this could be problematic. And so this mosquito is not only causing problems when it comes to Zika, it's also causing problems around these other diseases. The Zika outbreak, which hit Latin America in 2015, I would argue is emblematic of the threat that we face globally from infectious disease at the moment. It spread incredibly quickly. And the devastation from it was interesting in that it was a type of disease that at first people would get a mild fever, they might get a rash. Some people got no symptoms at all. And it was only later that it turned out that this virus actually can have devastating impacts on babies as they're developing in the womb. Some of those pregnancies didn't go to full term because the damage was so severe, and the children that were born that were affected by this are going to have severe developmental problems. And we don't even know, I mean, babies like this with microcephaly, it's obvious from the beginning that they were severely affected in the womb. One of the big questions that's out there is whether the thousands, tens of thousands of babies that were exposed to the Zika virus in utero and were born and appeared to be normal, whether 2, 3, 4 years down the road, when they start going to school, whether we might start seeing that actually they did have some, that the virus did have some impact on them. It's something that's being studied, and there's the potential that the impact of this outbreak is still not even been seen. And why I say that this is a sort of the new modern outbreak, it illustrated how quickly a virus could spread. This was in 2015 that it was sort of first noticed in Brazil that there was really a problem, and then rapidly it had spread throughout the rest of the hemisphere. People in our hemisphere hadn't been exposed to it. This is a virus that originally came out of Uganda, was where it was first detected. There's the expectation that there probably is some immunity to it in the people around that area. In Africa, it spread east through Southeast Asia. There was a big outbreak in Tahiti. But when it got here, when it got to Brazil, then it really sort of found its place to flourish. The mosquito was present that could spread it. There was a population that had never been exposed to it, thus had no immunity to it. And by this year, it actually had been spread throughout almost the entire hemisphere. And even further, they found that it's strains of the virus that was circulating in our hemisphere that have now gotten over to Africa, and it's spreading in Angola, Cape Verde, and Guinea-Bissau. And the expectation is probably spreading in other parts of Africa as well. And the question is why? These little mosquitoes do not flap their wings and fly up over the Panama Canal and spread the virus to other parts of the world. The virus is moving on airplanes. It is moving in people. People get infected. They don't even know that they're infected. They don't feel that they're sick. Maybe they do feel that they're sick. They move to another part of the hemisphere where, again, the Aedes aegypti is there waiting for them, bites them, gets that virus into the mosquitoes and ends up spreading it in an entirely new place. And it's because we have such a developed transportation infrastructure that viruses are able to spread so rapidly throughout not just the hemisphere, but throughout the world. And so this was obviously a threat for Latin America, but it illustrates that it really is a threat for the whole world. There's the possibility that a virus can emerge and within, as we saw here, within a year, spread throughout an entire continent and throughout the entire hemisphere. And we are not in a position to develop a vaccine at anywhere near the pace that a virus can spread. There's a vaccine, there's several vaccines for Zika that are currently in the works. The expectation is that these are going to be good vaccines, but we're still 2 or 3 years away from those being available for actual use. So on the one hand, we have pathogens that can spread, within, days, weeks, can establish themselves in a new area, and yet we don't have the tools to address them. And I think that this is this looming threat that is out there, that we've got this infrastructure in place which allows them to spread so easily, and yet we're not really in a position to combat them. And why does that really matter? It matters because people might say, well, I'm not pregnant, Zika is somebody else's problem. What Zika shows is that a virus can do this. And the next virus doesn't have to be Zika. The next virus might be something that doesn't really affect humans very much, right? And it does spread, and it goes all over the world. It might be a virus like HIV. It might be a virus that actually is, and I don't mean to be too gloom and doom here. There's no reason that the next virus, rather than causing microcephaly in babies in utero, that the next virus might, after several weeks, several months inside humans, turn out to be fatal to us. There is no reason why a virus couldn't do that. We've seen it in the past. History has shown us that there have been plagues throughout history, and we would be fools to think that we are not going to face some other major infectious disease, maybe not in our lifetimes, but sometime soon. And I would argue that our modern world and our transportation infrastructure make it more likely rather than less likely that we will face such a danger. And so to tie this back to what Latin America is dealing with at the moment, on the one hand, the Zika outbreak was a huge blow to tourism. There was talk about some people not going to the Olympics. It had major impacts on the healthcare systems in many of the countries that were affected by it. You had pregnant women flooding into their healthcare providers to try to get more information. I mean, people legitimately were freaking out over it, particularly in areas where it was spreading. It had huge burdens on the healthcare systems throughout Latin America. The Zika outbreak, which, in 2014 wasn't even on people's radar. At the same time, you now have in Latin America rates of obesity and overweight that rival anywhere in the world. Mexico is right behind the US as one of the fattest countries on the planet. And at the moment, diabetes has now become the #1 killer in Mexico. If you asked people what is the #1 killer in Mexico, very few people, I think, unless they're really in the field, would think that it is diabetes. And it's not, Mexico is to some degree worse off on the diabetes front than other places in Latin America, but much of Latin America is experiencing the same trends that Mexico is experiencing and the same potential outcomes, and some of them haven't started even measuring for it at the level that Mexico is. So Mexico is really at the forefront of trying to tackle it, but diabetes is continuing to rise there. Currently, 14% of the population has diabetes in Mexico. And a big part of it, the part that's controllable, and I'm talking about type 2 diabetes, which is the type that is brought, it's usually much later onset in life. Type 1, people can be born with it, but for this, I'm talking about type 2 diabetes. In Mexico, much of the problem is the rapid social change that has happened over the last 2 generations in the country, and more people having access to rich foods. And there's a wonderful culture in Mexico of great foods. These tacos here, they're preparing, these are, I think that was barbacoa on the bottom, and then they were putting French fries on top of them, along with nopales. I mean, it's actually an amazing mixture of food there, and they're delicious, and they're great. However, the Mexican diet has shifted from being heavily beans, corn, things like that in the 60s, and you started to have, in the 70s, a major shift of people moving to these big mega cities, moving into Mexico City, moving into Guadalajara, moving into Monterrey, even moving from rural areas into bigger what would be small towns. And change in lifestyle, people not being as active. And Mexico also became the world's leading consumer of soda. These are actually 3-liter bottles of Coke for sale. Basically, a lot shifted in Mexico over the last few decades, with people living in bigger cities and people having enough wealth that they can. Coke is cheap. They can afford Coke. They can afford to buy McDonald's and Kentucky Fried Chicken. And there are people in Mexico, I was just down there reporting on diabetes, there are people who argue that NAFTA had an impact in allowing American fast food companies to move in, allowing American retailers to establish their chains across Mexico. Walmart is actually the largest supermarket chain there, and Walmart stocks a lot of food that is similar to what is offered in the United States. So you had a situation where an American diet was available for a fairly low price, and people's income were increasing to the point where they could afford it. And what happened out of that, combined with a genetic predisposition for diabetes, which Amerindian people who have ancestors that were Mayan, that also Native Americans here in the United States, they are more susceptible to diabetes, to type 2 diabetes, and the onset tends to come at a younger age than it would for Caucasians or other Europeans. So in a way, it was a perfect storm. There was cheap food, there was cheap Coke, there was a genetic predisposition, and all of this has come together to create what the Lancet, the medical journal, the Lancet, just last month referred to as an impending catastrophic epidemic of diabetes globally. And it's particularly places like Mexico that they were talking about when they said that this is coming. This is a graph of rates of obesity and overweight throughout Latin America. Actually, the Bahamas is the one all the way over on the right. But you can see that many of the large countries, Argentina, Uruguay, Panama, Chile, all of them have rates of people who are overweight that are pushing up close to 60%, and rates of obesity above 25%. And the problem with this is that not just the human impact on people who are trying to deal with diabetes, is that this burden of disease is placed on a health system that was already struggling to provide services to its population and just deal with all of those other diseases that they have. This is a doctor. She works in a small senior, it's a senior center. It's just a drop-in center in a market in Mexico City, very close to sort of the Centro Historico in the downtown area. And people can come in and they can do crafts and things like that. But she also has office hours in there. And she's saying that she was telling me that the big problem at the moment is that people are not in a position to manage diabetes. So you've had this social change, which caused these higher rates of diabetes. And we know that there are more people in the pipeline who are going to be diagnosed with diabetes in the years and decades ahead in Mexico because they've been eating that way for the last few decades. And because we know that the predisposition is there. And she's saying that the healthcare system hasn't caught up and doesn't have the resources, in her view, to catch up with the care that is needed, the ongoing test strips to check people's blood sugar levels, the medications. She says she's constantly begging from pharmaceutical reps to get more medication samples that she can be passing out for free to the people who come in. And here she's showing me the example of some of the syringes that she gives to people so that they can do their insulin shots. Managing diabetes once it starts to progress is an incredibly, it takes a lot of attention to detail. It takes medication. It takes knowledge. And Mexico is starting to catch up with that. They're making an effort to deal with it, but they aren't there yet. And what's happening in Mexico, it is being recognized in other parts of Latin America, but there are parts of Central America where this is coming, and yet it isn't fully recognized yet. Those same patterns, those same eating habits have moved into places in El Salvador and Nicaragua. And this is going to be a huge problem for the entire region. And it's not just diabetes, it's heart disease, rates of cancer are on the rise. And to some degree, that is also being driven by people living longer. But my main argument is that at the same time that these nations are trying to deal with what have been traditional infectious diseases, traditional health problems, now there's this whole new set of diseases that are coming that are going to be a further burden on their healthcare systems. This is just an example, though, to show, in part, we are talking about societies that have changed dramatically. This is the birth rates, the crude birth rate for all of Latin America since 1960. I mean, it has changed dramatically. People are having fewer children. They tend to live in cities. Lifestyles have changed in many, many ways. And in some ways, very much for the better. The red line there is the poverty rate for Latin America. And if you look up there, I mean, just from 1990, where it was at 48%, the poverty rate in Latin America as the region. I mean, obviously that was a peak, but it was at 48% in 1990, dropping down to about 29% today. And actual per capita income also increasing, doubling pretty much from 1990. So I'm putting those slides up there just to really try to drive home that people's lives, people's incomes have shifted dramatically. And the health implications of that have also shifted dramatically, and yet it's not always as easy to see as it is to see a graph of what somebody's income did over the last few decades. And I need to just, I'm throwing out Haiti, also obviously part of this hemisphere. Haiti remains the poorest country in the hemisphere. And Haiti also, I think, is a reminder that many of these health problems, even in places like Brazil that have, such first world cities and incredible facilities and incredible health care, in Brazil, there are still places that are like little Hades. There are still places that are pockets in Mexico that you've got people who don't have access to clean water, people who don't have access to good sanitation facilities, and people who are still being exposed to mosquitoes that are carrying malaria, carrying dengue, carrying yellow fever. This is Haiti also, unfortunately, happens to be an incredibly unlucky country. I think they got hit by a hurricane just last year. It seems like when things can go wrong, they tend to go wrong in Haiti. And as if their luck wasn't bad enough, then you had the UN peacekeepers came after the earthquake and inadvertently ended up bringing cholera into a country that hadn't had cholera, spread like crazy, killed thousands of people. But the cholera outbreak in Haiti is another example of this globalized world that we have. You had troops coming from the UN, from a place where there was a cholera outbreak and where cholera is fairly endemic and people have a decent immune response to it, flying into Haiti. And as soon as it got into Haiti, hitting people who'd never had exposure to it before, and it was really devastating. And now it is all over Haiti, and actually getting it out of Haiti, I'm not incredibly optimistic that they're going to be able to do it without some significant improvements to water and sanitation facilities. But as I say, it's another example of how a disease from one part of the world can end up anywhere on the planet. And part of what is interesting is that that earlier diagram that I was showing about those airline routes going all over the place. The International Air Transportation Association says that in 2016 there were 3.7 billion passenger trips, 3.7 around the world, which is a doubling of volume from 2005. So what we have happening is this incredible change in the number of people who are moving. I don't know if there's any mathematicians here, but like statistically, if you've got 3.7 billion trips happening to all different corners of the planet, the likelihood that a pathogen could move has gone up. I don't even know what the magnitude is, but it's gotten to the point where the likelihood of one of these pathogens, if it emerges somewhere, ending up somewhere else, seems to me to be almost like inevitable, that it's going to break out and have a chance to get to a population that doesn't have immunity to it and cause an outbreak. And one other issue about sort of our modern world, this is from a trip that I did to Peru where I was looking at the impact of mercury poisoning related to illegal gold mining. One of the other things about our modern world is that there is this incredible desire amongst everybody to make a better living, to have a better life. And in Peru, you have people who were struggling in Lima, struggling in small villages to make a living, hearing about the ability to go over into the Amazon area of Peru and do gold mining and possibly make $10, $20, maybe if they got lucky, $50 a day on these illegal gold mining operations. And they go in and they basically clear cut the entire banks of the river and then sift all of the dirt that is along the banks of this. This is the Madre de Dios River. And the impact is that it, from an environmental perspective, is just devastating. But they also use mercury to extract the gold. The mercury ends up getting into the river and then accumulates in the river, moves further downstream. So downstream from these operations, you're ending up with children with mercury poisoning. They're eating the fish out of the river. So more of this desire to get ahead and this growing population on the planet is ending up causing other impacts which end up affecting people's health. And this is one of the mining operations. And I brought this slide in part just to show you that this isn't some big operation. This is like a slap together, that's basically like a car engine that they have on there. It might be even a little bit bigger than a car engine, which they use to run these pumps, and they pump the sediment out of the bottom of these pools, and they run it over these makeshift little screens that they have. And it's the type of operation that, with a bit of ingenuity, I mean, it's kind of a cool engineering project. Many people can take advantage of and start an operation which ends up both destroying the environment and causing problems for people's health further downstream. So just to conclude, I'm trying to make the point that Latin America illustrates how our modern world, in many ways, has become detrimental to our health. And we need to become more aware of it, and we need to try to tackle some of these factors which are making it much more likely that people are getting diabetes, much more likely that people are getting mercury poisoning. And Latin America sort of has to figure out how it's going to tackle this really complex picture that it faces of dealing with all of these old legacy diseases which haven't yet gotten completely dealt with, and deal with all of these lifestyle-related health problems such as obesity and heart disease and diabetes, if this region wants to have a healthy future. So with that, I'm going to open it up to questions. There's mics down here. Feel free to come down. I think we also sent it out on, people could text in questions if they wanted. Is that right?
Yes. The number to text should come on screen just a few minutes. We have some people who are Johnny on the spot already. I've been monitoring text questions. So as you're coming down to ask your questions, I actually have a few to ask Mr. Beaubien. But first of all, thank you again for the wonderful presentation. I think one question that you can speak broadly to this, but also specifically, is what government policies, what effect they have on public health. And the question that was asked me was specifically referencing Venezuela, but I think you could also speak to other countries that have governments that may or may not be helping in public health policies.
Yeah, well, Venezuela is a sort of a unique case at the moment in Latin America, with complete meltdown of the economy, the doctors basically getting out wherever they can. As an American journalist who only has an American passport, it's nearly impossible for me to get into, it's basically impossible for me to get into Venezuela. So I have not personally reported from there, but they're definitely in the midst of a health crisis, which is related to their overall economic problems. But government policy makes a huge difference in terms of health, and I shouldn't paint too. I hope I'm not painting too gloomy a picture, even though I did say that there's the potential for a plague that could kill us all at some point. There are efforts out there to address this, and many governments inside Latin America are very aware of the problems they face, and they are attempting to deal with them. I mean, Mexico, for instance, has put in place a soda tax, and it's called the soda tax, but it also is a tax on high caloric foods. They're aware of the issue. They're trying to change things. They're putting in new restrictions in terms of advertising around food products, particularly towards children, because the hope is that they can get to kids relatively early and deal with that. But I think one really incredible example, I cover global health globally, and one country that has done an amazing job of getting basic health care to its populations is Ethiopia. And it's through a government policy, and there are other places that are doing similar models, but Ethiopia, a while ago, put in place this program of, they call them lady health workers, who they place out in the community and they train them. You don't have to be a nurse to be one of these lady health workers. You get trained in just the very basics of what it is you're likely to encounter, malaria, diarrhea, dealing with pregnancy, trying to make sure that people get their vaccines on time. And these individuals are hired by the government, and they try to have one in every village, and they're responsible for just the super basics, making sure that the basic vaccines are delivered to children on time, making sure that pregnant women are getting the vitamins that they need. And it's been incredibly effective. It has brought Ethiopia's rates of various things way down. It has cut the cost of care, and because they're not nurses and whatnot, they've been trained that if there's a problem that's more severe, they refer these people somewhere else. So that's an example of a fairly inexpensive government policy that had an incredibly strong impact on the overall health of the population. And it also, one of the great things about it is that it's specific to Ethiopia. It served the need that was right there. And I think it's quite a good example of a government program that was able to address those health issues in a unique way that, as I say, suited the local environment. Yeah.
Thank you. We have some follow-up questions thinking about NGOs and what their potential role is in looking at public health issues in Latin America.
Yeah, I mean, there are tons of NGOs working in lots of different parts of not only Latin America, but around the world. Some of them are dealing more with crisis type of situations. Some of them are trying to deal with, deworming programs or, developing clinics. Partners in Health, run by Paul Farmer, has done a lot of work in Haiti, developing hospitals. I was talking earlier today, though, over at Hope College, and despite all the amazing work that NGOs do, and I don't want to diminish the individual work of individual NGOs, because some of them are doing fabulous work in the places that they're working. From my position as someone who covers global health and looks at these situations from a broader perspective, and sometimes I am just writing about one individual program, but looking at these programs around the world, I have come to the conclusion that ultimately this stuff needs to be run by the government. That NGOs can do good work, they're not going to solve the problem throughout a society. And there needs to be more recognition that there should be a focus on helping governments develop ministries of health, health clinics, health systems that address the very basic health needs, and that is what, on the long term, is going to provide for a healthy society. And so it's an interesting one. It's in a way like NGOs are like a stopgap measure. hopefully, I would say, a stopgap measure that would allow down the road governments to set up their own health systems that really serve their own people, because I think those are the only ones that are ultimately going to be able to do the big job that is necessary. Should we go over here? Yeah.
Sure. Talking about Latin America, certainly some of the diseases or health issues clearly go across borders, right? But thinking about some of those, an example like diabetes that you say is growing in Mexico, how do you see that as impacting the countries outside of Mexico? Is that more of an internal issue, or is it a global or regional issue? How do you see that?
It actually is a regional issue, because you have similar trends happening in many of these different countries in Latin America to a different degree. You might not have had, NAFTA and the opening up of some of these markets to American products to the degree that you have in Mexico. But a lot of that social change is also happening in other parts of Mexico, in other parts of Latin America, to varying degrees. I mean, places like Chile and Brazil are, these are middle-income countries now. These are countries that have a fair amount of wealth, but you also still have countries that are, extremely poor in Central America. However, you still do have fast food. It's kind of amazing. If you go to San Salvador, the amount of fast food outlets that you see there, and incomes are rising in those places. So the same trends that happened in Mexico, some of these other places are further behind, but I think you're going to see very similar, and you are already seeing, that graph that I was showing of the obesity rates. Mexico was all the way over there next to the Bahamas, but everybody else was pretty close. So these same societal trends, social trends that have happened in Mexico might not have happened to the same degree, but are happening elsewhere. And I think that, and you are also seeing diabetes rates rise in those countries, just not at the same degree. So I think it's going to be a concern. Yeah, over here.
Hi. First off, I'd like to thank you for taking the time to come out here. It's been a lovely talk.
Good.
But I also have a question for you about a topic that parallels quite a few themes of your talk, that being tuberculosis. So TB is generally thought of as a developing world disease, mostly in Africa, Southeast Asia. And overall, it affects 2 billion people at any given point in time. But there's some troubling new data about how drug-resistant TB incidence pops up. And there's some data that actually shows that it's more likely in places with middle incomes where antibiotic access is higher, but maybe not consistent enough to finish the 5-6 month course of treatment that's required to actually do the disease all the way through. So that holds true in Latin America. Peru has the third largest number of drug-resistant TB cases, and Brazil has the 5th. So is there any broader awareness maybe in the Latin American governmental sphere about this problem? Is anything being done to address it?
Yeah, I mean, drug-resistant TB is a huge problem globally. Peru is making a real effort to, Peru is very aware of their problem and is attempting to tackle it. There are actually, I don't know what's happening in Latin America on the regulatory front around some of the new drugs. There's a new drug called bedaquiline, which has been getting approval in various places. And basically with drug-resistant tuberculosis, the treatment for it can be devastating. It can cause deafness. It takes 2 years of taking antibiotics. The course there are different strains of drug-resistant tuberculosis. Some of it is called XDR, extensively drug-resistant. Some of it is just drug-resistant. But it's been a big problem in parts of the Eastern Europe, the former Soviet Union. It's been a big problem in Africa, and there's been, it's not just in Peru and Brazil, but Peru and Brazil in Latin America have been 2 countries that have had a serious problem with it. One of the good news is that there has finally been some new antibiotics that have come onto the market. I actually am not clear whether people in Latin America are getting access to them. Hopefully they will soon if they're not at the moment. I just haven't reported on it out of Latin America in a while. But yeah, it's the resurgence of TB is a very concerning, in part because TB is airborne. You know, we could have one person in here hacking away, and you guys could be exposed to it. And there's actually just a new study out of South Africa that showed that drug-resistant TB can be spread in that same way. And there's sort of been this feeling like, oh, drug-resistant TB is just those patients who don't take their drugs correctly, and they had TB, and then it turns into drug resistance, so it's sort of their fault, and so nobody really wanted to deal with it. And it is also very prevalent amongst people with HIV, so it's sort of a stigmatized population who tends to be more susceptible to it because their immune systems are already compromised. But this new study out of South Africa was showing that direct through-the-air transmission of drug-resistant TB they found that it's happening in South Africa, and the fatality rates from drug-resistant TB are kind of astronomical. I mean, there was this one example in South Africa of, I don't know, it's like 34 cases. I think 33 of the people died. They're doing a better job of handling it now, but it's quite bad. Sorry, I don't know more exactly from a Latin American perspective on that. But
That's fine.
yeah.
Thank you very much.
I'm going to jump over to this side. Oh, go. He was first. Oh, sure. Okay, we'll go to you, and then we'll go to you. Okay.
Thank you for being patient. So, great information here, and yeah, there.
Yep, he's got it.
Got it. So, great information, and information is key so long as there's a utility to it, right? So, recognizing the audience of, for the vast majority, white middle-class people of West Michigan, what utility can we use to actually make an impact that recognize, this isn't necessarily about us here, but we do have some impact in some way, I'd hope, to use this information to help the rest of the world come together on some of these issues. What could I do?
Are you a chemist or? No, I mean, so there's all kinds. I mean, and part of what is interesting about this, I think, is that there's a need for better study. I mean, the CDC actually was one of the leading agencies in fighting the Ebola outbreak in West Africa, and they never fully got credit for this. But there was this moment in the Ebola outbreak when this guy in Liberia was dying from Ebola. He was laying down in the airport in Monrovia. Some of his close relatives had already died. He was incredibly sick, and he decided he was going to get out of Liberia and go to Nigeria and get health care because he was sure he was going to die if he stayed there. He flew into Lagos, one of the most crowded, congested, chaotic cities in Africa. Landed, collapsed in the airport, was carried out by a taxi driver, ended up going to a health clinic there and dying there. Ended up infecting several health care workers. There's people at the airport. The CDC never fully got credit for this. The CDC sort of took control of getting a system in place to track every person who possibly had contact with this guy, and set up this amazing monitoring system, and they managed to contain what could have been an explosive Ebola outbreak in Lagos, which you could argue would have been such a nightmare. So when you think about, well, what is it that I can do? I mean, those people are, they're not solving the Ebola problem. These were people who came up with logistical solutions to how do you track down anyone who might possibly have had contact with this person and monitor them. So, these were CDC epidemiologists, but you never know where it is that your skills might end up playing a role in dealing with this. Certainly, from a diabetes perspective, there are very high rates of diabetes among Mexican Americans. Research into what's happening amongst Mexican Americans here could have huge impacts potentially there. Maybe some, I don't think some miracle cure is going to come along, but maybe there's some insight that can come out of that. So I think that the research that's done here definitely can have an impact throughout Latin America. And I told that Ebola story in part because you just never know what it is that are the skills that are needed to deal with this, with these types of health problems. So,
Thank you.
you're welcome. Yeah, come over to you.
Thank you for being here tonight, Mr. Bobian.
Yeah.
My question, I'd like to bring this issue home to our geography here in the United States a little bit. As we know, the Republican Party is repealing the methane flaring rule in the West, and in particular in the Four Corners regions of the United States. People there, I've read, are already beginning to scramble. Local communities are very concerned about the excess methane gas that is going to be flared into the atmosphere in their areas after years of locally working to contain that issue and seeing their work go for naught because of this repeal. And I would like to suggest that maybe, if NPR can give that some coverage, because that is an emerging issue and it deserves to be covered. Methane is a very potent greenhouse gas. And I was wondering if you could comment on, what you might know about that region. And as I said, they really are starting to scramble over there.
No, thank you for that. Because of partly how NPR is structured, I end up almost exclusively covering international issues around health, and we have other people who are covering domestic issues, and that would obviously fall into somebody else's beat at NPR. But and I'm completely unfamiliar with the health effects of this, so I'm going to not attempt to talk about it. But no, we'll give it some thought, and I'll try to run it by some people who it might be useful for at NPR. Thanks.
Thank you.
Yeah, come over to you.
Hi. First of all, I want to say one thing that we can do as people in West Michigan is not take antibiotics unless you really need them and finish the whole course of antibiotics, because that's where drug resistance comes from usually. And then I have a question about Cuba, as they've been mostly cut off from American influence that we see in Mexico through NAFTA. And they have their exquisite healthcare system.
Right.
So what is Cuba experiencing in terms of legacy diseases and new diseases? And then if they're going to see American influence in the future, they might serve as a case study for how our influence impacts that. But mostly I was just wondering about Cuba's, how they're dealing with that or what their rates are.
Yeah, I mean, Cuba is has an amazing healthcare system. Yes, they've got advances that on some things that we haven't even gotten to. They do a really good job, actually, of mosquito control, and it's one of the benefits of sort of both, a somewhat authoritarian. It's much easier to do mosquito control if you can, sort of enforce that everyone needs to do this. And they are able to do that in a way, make sure that there is no standing water. And so they did have a couple of Zika cases, but it was really quite low in terms of Zika, which is actually really surprising when you look at the position of Cuba and you look at the rates that we were seeing in Puerto Rico, in the Dominican Republic, in Haiti. It's actually quite interesting. The majority of the US cases of Zika were related to the Dominican Republic. They were people who had traveled back and forth between the US and so it was really interesting. There were more cases in the US of Zika that were being listed as being related to Zika coming from the Dominican Republic than actually had been reported by the Dominican Republic. But you had this very high level of a virus circulating there. And again, the CDC did an incredible job of monitoring what was happening in Puerto Rico. And in Puerto Rico, in the donated blood supply, at one point, when sort of the peak of the Zika outbreak, 1% to 2% of the blood that was being donated was being screened was found to actually have it, which showed that this incredibly high level of virus that was spreading. And we're almost 100% sure that exactly that same level of virus spread was happening in the Dominican Republic and Haiti, and which is right next to Cuba, and yet Cuba got very little of it. Again, part of that is this cutoff between the air transportation routes aren't as intertwined for Cuba, although Cuba people are moving throughout the hemisphere to there, but their ability to control the mosquitoes really meant that they were able to keep Zika at an incredibly low level. There's a lot of things that could be learned from Cuba, and hopefully as relations warm, some of the things that they have done really well will be even more broadly spread here. And I actually don't worry that they're going to have sort of that flood of the change of diet to Coca-Cola. I don't know. Who knows? We'll see what happens.
So good, though.
Yeah.
Okay, thank you.
Thank you for being here.
And that'll be the last question over here.
Thank you for being with us tonight.
Yes.
Thank you.
My pleasure.
You were saying that the growth of the obesity and diabetes in Latin America has been really greatly. Do you think, and you said also that is because Latin America changed their lifestyle. So do you think that the U.S. owned businesses have, meaning like Coca-Cola, have any kind of responsibility in shaping that lifestyle change? Number one, and also like the example that you put there about Peru and the mining and doing that stuff. Do you know who are the owners of those gold mines in Peru in that case, in South America? If they are U.S. corporations again, or European corporations. So my question is, what is the responsibility of U.S. corporations when dealing with these diseases in Latin America?
Okay, yeah, I'll start with the Peru gold mines. So part of what's fascinating about that is a lot of that was happening on land that is actually nationally protected forests, or some of it was actually parkland. And these are not, that example there is not being driven by any corporation. It is, however, being driven by the global rise in the gold price. I don't know what the gold price is at the moment, but I think it's still above $1,000 an ounce. And if you looked back 15 years ago, it was much lower, and it was not worth anyone's time to go in there and dig through the river and sift it all out if you were only going to be getting, as these guys are, because they're not getting the top price because it's clear that it's a little bit shady. If they were only going to be getting, let me just give an example of $100 an ounce instead of $800 an ounce, it wasn't worth their time. So these global markets for commodities and for gold ended up spurring that type of gold mining. So it wasn't some particular corporation, and it's almost hard to say, is that some evil thing, but gold increased dramatically in price from, I don't know when it was sort of at a low, but it really hit a high, I think it was about 5 years ago, someone else might know, but the gold price rose dramatically, and that made people think that it's worth my time to go in there. In terms of the U.S. corporations and the responsibility for some of the problems with health and whatnot, you know, it is unavoidable if you go into some remote village in many parts of Latin America, places that have almost nothing, you know, and there'll be a small shop and they will be selling Coca-Cola or they will be selling other types of sodas. And it is, you know, I'm not trying to just demonize these corporations, but these corporations clearly have a profit motive and have set up systems to deliver a product that is causing health problems throughout. And the penetration is unbelievable of these products throughout Latin America, almost throughout the world. And I do think that there needs to be more of a recognition of how corporate practices have contributed to health problems. And it's interesting in Mexico, which has attempted to put into place a soda tax and did put in place a soda tax, it was that the soda industry fought it tooth and nail, did everything they could to discredit studies linking sugar to these problems. And I think that hopefully, they're producing a product, that people want, but I think there does need to be a recognition from a corporate side of the health problems that they are contributing to through some of their products. And I don't think we have gotten to that switch. I think the sugar is going to be the tobacco of the 21st century. It's going to be a product that, that people are going to start to say there is a responsibility to not be producing highly caloric products, marketing them aggressively to children, and taking in the profits from that and not recognizing that there are health implications from it. So I think that's a shift that we are going to see in the coming years, and I don't think we're there yet. Thank you.
Wow. Thank you, Mr. Beaubien. Thank you very much for such a comprehensive presentation of the importance of healthcare policies and government's role in tackling all these challenging situations. Thank you so very much.